All right, guys. All right, all right, all right. Let's see. Move that. All right, so we are live. I'm just making sure I am live on all my social media platforms. It looks like we are good to go. So, what's going on? Good afternoon, everybody. I'm yours truly, Dr. Barry Pierre, board certified internist, founder of drbarrypierre.com. We are going live on multiple places today. We are going live on, let me check, Facebook. We are going live on YouTube. We are going live on Periscope and Twitter. This is episode 71. This is the Empower Yourself for Better Health series. Clearly, just based off episode number, I've done 70 of these. This is where I come to you guys live, answer your questions live, and talk about very important health topics. And of course, again, unless you live under a rock, the most important health-related issue kind of going on right now, well, there's two of them, but let's say number 1B, right, is the coronavirus, right? And we are going to be talking today about the fact that we just hit a milestone that we shouldn't necessarily be proud for hitting, but we have crossed the 2 million mark as far as confirmed cases, and we're going to talk about the importance of me stressing the word confirmed, because there's a lot more cases out there. We definitely know there's a lot more cases out there of the coronavirus, but for those, as far as from a sheer number of how many cases we know that's out there, it's over 2 million, guys. So and I'm throughout this today's episode, I'm actually going to show you the clip. I'm not even showing you the clip. I'm just going to show you a still shot of where we were 3 months ago when I reported or talked about our first, when I did my first corona, because this is actually my third one. So when I talked about the coronavirus in March, right, we're going to get a quick little still shot of where I was at as far as the numbers game before, and unfortunately where we have gone today. So for those who may not know, again, I have been talking about the coronavirus a lot, right? Whether it's been on the podcast, whether it's been on the videos here. And I've kind of talked about really for us stressing the importance of it, especially now that all states have kind of reopened, and our ability to social distance is kind of decreased, right, dramatically. I think it's very important for us to kind of give an update on what's going on, why the states. I've talked about why the states are opening. You know why? Business, money, everything else. It was never really health related stuff, and we're going to show some graphs and numbers of why that truly is. So first and foremost, if you have to choose, especially with me, right? If you say, you know what, I only want to go to one spot to learn my coronavirus related information, especially for the majority of people who watch me, wherever you're watching me at from a social media standpoint. You guys know that I'm a big fan of making sure you kind of centralize your information. That way you can get correct information. There's a lot of information out there, some that's good, some that's not so good. There's a lot of people talking about the coronavirus. Again, some good, not so good, and especially for the typical patient customer base that I'm talking to. I want to make sure that I stress that when you are looking for a source, I want to make sure that's not over your head as far as from a learning standpoint. So I always talk about the CDC because I think one, right, it's our our governing body, right, and it's very factual information, and it's very easy to read information that you, the patient, can get, right. Because again, remember the goal: empower yourself for better health, right. That's really the goal, right? We want to make sure that you can take the information that you get from these websites and be able to apply it for your life and make sure you're a healthier, better you. So let's check out the CDC's website, right? Again, just in case you're like, Dr. Barry, I don't think there's too many cases, right? I don't believe you, right? Again, that's true. That's okay. So we're going to be, so throughout the day, we're going to be kind of going back and forth, streaming on different, sharing my different pages just so you can kind of get an idea of the severity that's going on here. So let's share our first page here. All right, give me a second. Perfect. So this is the CDC's website. Let me make myself a little bit smaller so you guys can see a little bit better. Perfect. CDC's website, right? So again, front page, updated June 12th, 2020, right? So as you can see, we have hit a little over 2 million cases, right? Again, we actually crossed this number on Monday I'm sorry, Sunday. I think it was like Sunday evening when we like officially hit the 2 million mark. But it was Sunday evening when it hit the 50 million mark. We're over 100,000 deaths, right? So again, just very significant numbers that we really need to be concerned about, especially when we're thinking about what does this mean for me, and what does this mean again. I always stress not only what does it mean for me, but what does it mean for my family? What does it mean for my job and working and everything else? Because as a health professional, right? As a health professional, I get this question a lot, all the time. I get this question from other health professionals, guys. So I don't want you to think that the only people who are given this type of question out is the lay person, right? Like, again, I have a lot of doctors who are asking me questions out of concern. So 2 million total cases, right? Again, this is just a nice little blip of the map that's going on here. Just for a sheer color coding, especially if you can't necessarily pick out the color coding. If you're in blue, that means you have over 40,000 reported cases in your state. If you're in blue, over 40,000 cases in your state. I want you to peep like why this is much different than that, right? Look at this here. This is 172,000 cases, but it excludes New York City. And we're gonna actually go to a different page to kind of show you how many cases are in New York City, right? Like, that's how many cases are in New York City, that they say, let's just report the state, and then let's report how much is in New York City, because that's where we're at. But of course, obviously, I'm in Florida. About 67,000 cases. Texas, about 81,000 cases. California, 139,000 cases. This whole Northeast area, just isn't, 104,000 in Massachusetts, 44,000 in Connecticut. Pennsylvania, 77,000. Ohio, we're getting to the Midwest, right? Ohio, over 40,000. Michigan, 65. Illinois, 131,000. Virginia, 53,000. Again, and we're starting to see, like, again, North Carolina is going to turn blue pretty soon, right? So this is, again, a lot of these blue states, right? We probably expect, when it's all said, and a lot of these, I guess I would say, like light green or light blue per se, we expect them to eventually turn dark blue as well, right? Again, just to give you an idea, especially if you did not think like, all right, yes, we got 2 million cases, but what does that mean? Like, we got a lot of cases everywhere. And of course, this is the outlier, right? 573 cases here. Again, and if you're watching this and you're from Montana, I apologize. I don't know how many people are actually in Montana, right? Again, I apologize, right? But I don't know how many people are in Montana, but like 573 seems extremely low. I'm not sure how many people they're actually testing. But they probably, maybe just from a sheer location standpoint, do a great job at social distancing, because ain't nobody around each other in that regards, right? So again, that's what's happening here, right? And then, as you can see, right, again, this is the total United States, right? What we saw in the beginning, right, and what we were hoping for in the beginning, is that we were going to get this typical curve and the typical bell shape of a curve, where it would kind of go up for a little bit, and then it would hit like a peak where it would start going down for a little bit. But again, as you can see, and I'm actually going to show a much better graphic later on, especially for Florida and kind of a few other different states. This really isn't going down. And for many of us, especially for me in a hospital setting, right, like, we expected to have a higher number of cases, once things kind of open up. I don't even believe we expected to have this amount of higher number of cases once things open up. I can tell you, in our hospital, we're getting busy, and that's not a good thing, right? Especially if you're one of my interns who are watching me. Especially, I'm not sure. No, you guys don't start in the ICU, but something to look forward to. There's a lot more cases out here in Florida, a lot more cases out everywhere, kind of moving forward. So again, this is kind of the age breakdown, because again, and a lot of people, what I love, let me get some water. What I love is that a lot of people will say, oh, this is an old person disease, right? Keep the old people in home. But look at the people who are getting it. 18 to 44, 45 to 64 make up the majority of these cases here, right? So again, stop believing that you have to be 65 and older to be really affected. No, in fact, the elderly are doing a great job staying away, doing their social distancing. It's the 18 to 64 range that is not doing that great job. And then race and ethnicity, as we can see here, Black, Hispanic, white. Again, those make up the three largest classes here. 22%, 33%, 34%, right? And of course, those who maybe, again, those who maybe think like, wow, like that's a lot of cases for white, like, well, whites have more. Of course, whites should have more, right? Because there's a lot more people here, here in United States. But when you think about the fact that, we don't make up 22% of the electorate, right? Hispanics don't make up 33% of the electorate, right? That's a problem, right? Like that's a problem that we have to typically deal with, right? Because they don't make up the certain number of cases here in the United States. So why are they making up these certain number of cases here? Like, and I've talked about that on I think podcast episode as far as just kind of the racial breakdown. And this is obviously, this section right here is a little bit more important for me, right? Because obviously I am a healthcare professional, and not only being in the healthcare world, right? Like I take care of patients who have COVID-19. I have taken care of patients that have COVID-19. I've seen a lot of people be able to walk out the hospital, and I've seen a lot of people not be able to. I wouldn't say a lot, but I've seen people not be able to leave the hospital, right? So these numbers, are definitely startling from a professional standpoint. Me as a program director, taking care of residents and obviously featuring medical students as well, and like look at the amount of cases that the people on the front lines are getting beaten up and taken with, right? So then definitely concerning, right? When we're talking about the coronavirus, right? And again, I just want to kind of give you that overview again. CDC website, that's the site. Again, if you can only choose one site to go to, that's the site you want to go to. Again, symptoms, testing, preventing, like all these nice things. That it's a very easy read for anyone who wants to be able to have that easy read. So, and look at that comment here. Yeah, so I love editing. Pam says a great thing. When we used to, especially in the beginning, when we were talking about the coronavirus, I think a lot of people, and it was kind of disheartening. It was very disheartening when I would see, people on the news and even just people just in general say that, well, it's only old people will die from this, right? Like that was their thought process. That to the point where I don't want to wear a face mask because only old people are going to die from this, right? I don't want to stay 6 feet away from people because only old people are, like, that was their mindset and thought process. And she says, a great point. This is on Facebook where she talks about, she felt that society did not value the older population. And I will 100% agree with you. I think society clearly said that they were okay with the older population passing away from disease. Clearly, we are 113,000 plus. Let me correct myself, make sure. Yes, 113,000 cases of deaths due to this disease. And we saw the numbers. The numbers are not just older people, but because society was okay with older people dying, unfortunately, again, not everyone, right? Because, unfortunately, you got to say not everyone because people feel guilty. But because people felt that it was okay that older people died, people were like, we'll just kind of take our chances with the disease. And clearly, those who took our chances have failed, right? Like you did not win that game. Again, thank you for all, especially so all of especially my older patients, my older listeners, especially here in the electronic community, who are trying to practice social distancing as much as they can, wearing their face masks, using a hand sanitizer. I mean, again, much appreciative of that because it's extremely, extremely important. So what I want to do, again, we saw what those cases are. I wanted to, again, especially to kind of give some perspective. Again, when I first did episode 69, right? When I did episode 69, I was, again, 2 episodes prior when I said, okay, hey, coronavirus, public health crisis. Again, for those who may not know, not only am I a osteopathic physician, program director, director of medication, all that good stuff, I'm also have a master's in public health. And my thesis was actually in program evaluation. So when it first started, I was very concerned. I was very concerned that the people we had in leadership was going to drop the ball. Again, that was just me and my program evaluation side looking like, I do not think they're ready for what's coming. And clearly, the answer was resounding yes. They were not ready for what's coming, and that's why you have 2 million cases in over a 3 and close to 4 month span, right? So I just want to just show you the screenshot of what the number, and I'm going to that same CDC website. This is just a still shot of episode 69 that I did, just so you guys can get an idea what was their numbers like at that time. Give me a second here. Let's share our screen. All right, just so you can kind of, and again, this is, as you can see, I was like just really just kind of explaining, hey, well, what is the coronavirus? Because that's how early it was. Like I was in the explanation mode of what the coronavirus actually is. So as you can see, screenshot here at the time when I recorded that video, which was, let me see, looks like March 12th, 2020. The number of cases were under 1,000. Number of cases were under 1,000, 938 to be exact, and total deaths were just 29. And today is exactly 4 months later. So 4 months later, I am talking about the fact that we have over 2 million cases and over 113,000 deaths. I can tell you, for those who may not be aware, that is not a good job. That is a system that unfortunately failed us here in our country, right? Because that should not happen, especially in a country like this. In a country like this, we should have been prepared for something like this. Because, like, how does 938 turn to over 2 million? How does 29 deaths turn to over 113,000 deaths? And I'm not telling you that we would have prevented the influx of the 113,000, but I can tell you it should never have been that high, right? So again, I just wanted to kind of give folks some perspective on what we're talking about, right? Like, and why, especially as a hospital physician, as an educator, as one who is in the health influencing space, to understand why we are so serious about talking about this disease. It's the reason why now, I can tell you, I do a lot of health teaching, right? Especially if you're in my private group. I know my private group's watching. If you're in my private group, I typically do what we call mornings with Dr. Barry. In fact, I haven't done it the past couple of days. I kind of forgot. Apologize. But what we typically will talk about different health related topics. It is becoming harder and harder for me to find a health related topic that does not have to include a coronavirus. Like that is how much, which it should, right? Because again, when you have a disease that affects over 2 million people in a 4-month span, that should be front page, and then the second page, and then probably third and fourth, right? Totally understandable. But that is a level of severity that this coronavirus really has affected us, right? And for those maybe asking, well, and especially the question of, well, we're open up now, right? Like, all this before, right, in March, and this is in when we were saying, everybody stay at home, people are on lockdown, people are on curfew. We were able to stave that off, but unfortunately, what we've seen, which we expected, but I don't think we expected it to happen this quickly. What we see is that the number of cases have dramatically risen since places started opening up, right? So again, let's we're gonna keep doing our little share thing here, right? Because again, I think it's extremely important for us to see. I saw this article come out a few days ago. So this one, 9 U.S. states seeing spikes in COVID-19 hospitalizations. Before we even get to this one, I'm going to talk about obviously, my state, because I could talk about that pretty easily. In our Palm Beach County, well, at Wellington, right, our hospital, it was very evident that we were getting more and more coronavirus cases, right? It was very evident that our service is getting much more busier. In fact, like when I did the numbers a couple of days ago, and we had like a 20% higher clip as far as just the total number of patients in our census, the hospital census, than we've had, right? And then when we did the numbers, right, when we looked at the numbers, over 25 cases were secondary to patients with the coronavirus, right? So again, over 25 cases, right? So we were like, we were thinking like, oh wow, you know what? It's a lot more patients in the hospital. But unfortunately, not only was it a lot more patients in the hospital, it's a lot more patients with coronavirus in the hospital. And those patients, if you don't have coronavirus, remember the patients with heart attacks are still coming. The patients with strokes are still coming. The patients with muscle pain and broken hips and broken ankles, they're still coming to the hospital. Those who need a gallbladder taken out, still coming to the hospital. So we saw this rise, like almost it was very noticeable here in our little area of Wellington. So me seeing this article doesn't shock me one bit. In that regards, right now, this is where we really should be concerned, right? and another troubling sign that the spread of coronavirus might be accelerating. Like again, a lot of us knew that the coronavirus would come back, right? Now, and I say come back because it actually never. That's why I put back in quotation marks in the title, because it never actually went anywhere. We just figured with all of the quarantine that we did enough to slow it down so that when it would come back, it wouldn't come back at such a dramatic rise. Unfortunately, we are seeing the comeback at a dramatic rise, right? So that's kind of what we're seeing here. Again, and this one kind of highlighted 9 states. And remember, a lot of remember in symbolically, again, I guess whatever, right? Symbolically, a lot of states opened up around Memorial Day. So of course, now we're starting to see all of those, openings really start to affect us, right? So again, the ones they mentioned here: Texas, North and South Carolina, California, Oregon, Arkansas, Mississippi, Utah, Arizona, all have seen dramatic rises in coronavirus cases, as far as those who are confirmed, or those who need. And again, I think I think especially as a hospital physician, and especially as a patient, right, when you're trying to think about yourself, like, all right, what do I need to, what should I be very concerned about? For those who understand, we expect more cases to be confirmed, right? And by confirmed means you did the nasal swab test and it was positive, right? That's one thing. But the fact that patients are showing up in our hospitals, right? The fact that patients have to come to the hospital because of the coronavirus, that is the concern. Because, and like the reason why we went to quarantine, our hospitals cannot, I promise you, cannot deal with the influx of patients in our hospital setting, because the numbers aren't there. Preparation just isn't there. Again, for example, Texas reported 2 consecutive days of record-breaking coronavirus hospitalizations. Now, imagine what that means. When coronavirus was first happening, we were having significant number of patients being admitted to the hospital across the country. And after us quarantining, after us social distancing, after us putting on the face mask, we're starting to see record-breaking number of hospitalizations. That is a problem. That is a sign that we really, really, really should be very, very concerned about. Look at this one. The state which was one of the first ones, Texas. Again, shout out to Texas, because usually Florida gets these types of numbers. And honestly, I'm actually surprised Florida is not in here, because I did read an article that said Florida is definitely not doing very well. And we'll actually point to Florida in a little bit. Has seen a 36% increase in new cases since the end of May. Right. So again, this is a problem, guys. Right. This is a problem. And what I love here, right, is that they focus, because again, there's always the pessimistic person that says no, the only reason why we're seeing all these cases is because we're testing more, right? Like, yes, again, you can test more, right? That's interesting. Yes, you can test more, but those who are testing should not be ending up in the hospital. That means they're sick, right? And just the sheer number of it, again, like I said, challenges the notion that the country is seeing a spike solely because of increased testing, right? Because again, they're ending up in the hospital, and that is a problem. That is a problem. And I love to show that parts of the country that had been spared the worst of the coronavirus are now tallying record numbers of infections, right? So, like, as when we saw Montana, with the 537 cases, right? Maybe there wasn't enough people there, right? But in places where there's plenty of people, right? There's plenty of people to have to spread the disease. We're starting to see that spread occur, right? Oh, again, okay. Now we got a Florida mention. And since the start, June 14, states and Puerto Rico have recorded their highest 7-day average of new coronavirus cases since the pandemic began. Arizona, Alaska, Arizona, Arkansas, California, Florida, Kentucky, New Mexico, North Carolina, Mississippi, Oregon, South Carolina, Tennessee, Texas, Utah. Again, since Memorial Day, right? Since Memorial Day, right? We're now seeing higher number of cases on an average per day, right? And we're already challenging the fact that it just isn't because we're testing more, because these folks are ending up in the hospital, right? So that's the problem. And again, I can tell you one thing that will not happen, especially in this country, right? We will not be going to and I can put this a link in the comments and show notes for those who may want to follow that article. One thing that won't be happening, right? We will not be doing a quarantine again, right? This country, unfortunately, the business powers that be will not allow that to happen. So that's not happening, right? So we are going to have to now deal with the new norm of we are going to get a boatload more cases of the coronavirus, and we're just going to have to deal with the fact that, you know what, our hospitals are overflowing. We're going to have to deal with the fact that, again, ICUs are being overran. Like, we're going to have to deal with that fact, because they've already put it out there that we should not expect us to go back into quarantine, right? Again, and I hope they prove me wrong, right? I hope they say, no, 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 there's way too many cases out here. Go back, right, to where it needs to be, right? Like, go back, like, because that's an issue, right? Like, but like, again, I'm pessimistic in that way, that I feel like the business powers that be and the economy essentially crashing because of this virus. I just don't believe that that's going to be the new norm. We're going to have to, again, if you're uncomfortable wearing a face mask, you better get very comfortable, because there's not going to be a single reason why you're not, right? There's like, that ship has sailed, right? Like it's going to be the new norm to wear masks, right? To the point when you walk to Publix, or you walk to the grocery store, or you walk to, wherever you're going, if you don't see someone with a mask, you are going to look at them crazy, right? Like, that's very, very interesting. I know somebody asked me a question. How much of Florida hospital? Oh, Florida hospital. I don't know how much from a Florida hospitalization standpoint. And if I can, I'll definitely try to look for that information. We'll actually talk about kind of Florida. In fact, let's talk about Florida now. So the question was, you know that you mentioned your hospital is seeing increased cases of COVID, but do I know how much Florida hospitalizations are increasing now, right? So again, I don't have the necessary rate of how many hospitalizations we're getting in Florida. But let's check in Florida. Most states, I'm assuming, right, have great sites that are specifically focused strictly on COVID-19, and Florida obviously is definitely one of them. Let's check out Florida site here. Right. So this is, again, Florida Health COVID-19.gov. So this is Florida's site as far as getting the most accurate information that you can. Again, let's just get our sheer numbers out here. 69,000 cases right now. Positive cases here. I'm sorry, 70,000 positive cases in the state of Florida. About 2,800 deaths here in the state of Florida. Again, positive cases by exposure. Before, remember when we used to ask for travel? Like, travel doesn't mean anything no more, because coronavirus is here in the United States, breathing in the United States, living in the United States, has set up homes here in the United States, right? So it doesn't matter if you travel to Wuhan, or it doesn't matter. Like, we know there's enough coronavirus here to kind of go around from that standpoint. So I want to check out the data from Florida's thing. So let me share this page here. Let's see the Florida data map. All right. So again, this is a data map of the state of Florida, just so we can again see the number of new cases since, again, this is the past month. So as we can see, right, the number of cases. Again, remember, we were hoping for this bell curve to happen. There's no bell curve happening. There's just cases that are just continuing to go up, up, up. Like, that's the concern, right? Like, we're just seeing more and more cases, and you can just see the spikes. You can see the spikes. You can see it. Just, again, we're going to keep having days where just record highs, for the most part here. And then, just to give you an idea, again, they did a great job kind of color coding, the state as far as who has the most. So again, for those who may not know about the state of Florida, these the three in the bottom right are our biggest counties, period. We have Palm Beach County. This is kind of where I reside. So Palm Beach County looks like 8,200 cases here in Palm Beach County. Let's see. Broward County has 8,500 cases. And the reason why that's very concerning, especially if you were in Palm Beach County, so, Palm Beach County, definitely listen up. There was a time when Broward County had over 1,000 more cases than we had, right? So there was a time in Broward County that they had over 1,000 more cases than we have. And as you can see now, the numbers, right, are separated, by a little bit over 300 cases. So, it's so funny because I read an article probably about it was probably like a week and a half ago that said that Palm Beach County was going to be the new epic center for the coronavirus cases. And of course, I thought it was more hyperbole, right? But clearly, like they know something that we don't know in Palm Beach County. And you can see here the total number of just hospitalizations, period, have been 11,000 hospitalizations. But I wish I knew, how many have been recent, because that would have been a great number to know. And then Dade County is really in its own real ballpark. 20,000 cases, right? About a little bit over 20,000 cases in Dade County. So what are some of our other offenders? Of course, if you're in the Tampa area, you got about 3,200 cases. Orlando, Orange County area, 2,700 cases. Jacksonville, 1,900 cases. And I know that they're actually going to do that. I'm not sure, like a Republican convention. I'm not sure what they're doing in there. I know they're coming to Duval, so you definitely expect that case number to rise as well. So this is, again, especially if you're in the state of Florida, this is a problem, right? Like this is something that you're not going to be able to ignore. Like, again, the only way you could ignore the coronavirus is just like closing your eyes and not turning your TV on and not listening to radio. Like the only way you could have avoided dealing with the coronavirus. So you're not going to be able to deal with it. You're not going to be able to avoid it. You're not going to be able to hide from it. But kind of here we are. And I want to go back, right, just to kind of show, because we talked a little bit about New York and just the sheer number of cases that were in New York. And what was interesting was just, the fact that they had to exclude New York City. So this right here is our case index for New York City, guys. So this isn't the state of New York. This is New York City. New York City has and again, this is just confirmed, 209 cases with 17,000 deaths in New York City. And and I love it. So they have the total of, and just in New York, is about 382. So again, when we talk about numbers, Gabe, about the coronavirus, New York is in a different ballpark. But I do want you to, I would love you to peep. In fact, let's do last 30 days, right? I do want you to kind of watch over what we're looking and seeing here in New York as far as the past month, right? These are just new cases. And first of all, this is Google, right? So I just did a New York coronavirus cases, boom, and Google has this nice thing here that I love to see. But the most important thing, especially depending on where you're watching me from, depending on which state you're in, this is when you should be concerned, right? So let's, again, I'll start the fire, Scott. The state of Florida, right? Like the one trend, even if you don't look at the numbers, the one trend that you can see in the past 30 days is we were here and we are trending up, right? We were down here and we are trending. This is around quarantine. This is when they were forcing us to stay in the house. Now that the places are open again, and it's not, and Palm Beach and Dade and Broward, the places that are really hit with the coronavirus, we haven't even fully opened yet. And look what's happening to the numbers. We are just seeing this trend that is going up. Let's look at Arizona. We know that was a problem. That was one of the 9 states that were listed again in the past month. What is this trend here? Again, we don't even need to know the numbers. As you can see, 440 on May 13th, 1,400 on June 11th. Again, we don't need to know the numbers. We can just visually see these things, right? We can visually see that we are in for a problem. Let's go for Texas. Texas is one of the first states to open up. Shout out to Texas. Texas was high when it was there, and then there's been no drop off, and in fact, there's been spikes, right? And then still, even though it was here at 1,300 cases, right, in May 13, now it's at up to 1,800 cases. So even though Texas started high, which is concerning because it asks you, like, why did they open up so quickly? Like, it's still high. Let's go over. Oh, California is another one. California is another one as well. Again, starts low, starts high. Like, again, I could do this all day with these different states here, but this is our concern. This is the problem that we have, right? So again, yes, we are 2 million cases and counting. There's a lot more, and so I saw someone I was on Twitter, and someone was saying they were concerned about the death rate, right? They were saying, are you telling me that the death rate is 10% or 5%? What, I forget the number that they said, and I had to let them know. Unfortunately, fortunately, right, because they were concerned about, like, coronavirus really killing a lot of people out here. even though, yes, we see those confirmed cases about 2 million, there's a lot more people walking around with the coronavirus who can, spread and give the coronavirus to other people who don't even know it, right? So and that should be, if nothing, right? Nothing I say today, right? Especially because, again, I've been talking for a little bit, right? If nothing I say today drives home the fact that we still, unfortunately, have to be careful. We still have to have as much precautions as we can. That should drive home the fact that even though we got 2 million cases, right, there's a lot more, right? Maybe there's 2.5, maybe there's 3 million. I don't know, right? Because I know that a lot of you are walking with the coronavirus, don't even realize you had the coronavirus, and gave it to somebody else, right? You gave it to somebody in Publix, you gave it to somebody at Walmart, you gave it to somebody at the gas station. You didn't even know you had it because you had no symptoms. But now they're home, or they're seeing people like me in a hospital with said symptoms, right? So definitely an update that I wanted to make sure. One, I don't want to. I am not here to necessarily scare you, but here to let you guys know, like, yes, as those me in the front line, you know what, we're worried, right? And if we're worried, even though I know the news cycle, right, is doing what it's doing, right? Like, we want to make sure that you guys should have a little bit of worry as well too, right? So if you're walking out here thinking I don't need to wear a mask, don't do that. Like, don't do that, right? Like, you should wear your mask everywhere you go. Again, I ain't telling you not to live your life. I'm just telling you that there's going to be there's a lot of risk that you need to be willing to take, right? And if you're willing to take it, go ahead. But like, you have to be willing to take it, and you're not going to be able to feign ignorance, right? Because especially because you're going to have multiple people like me, right? Either doing podcasts, either doing videos, doing live streams, doing whatever we can to scream from the rooftops, right? That you should be worried, right? So if you don't get anything today, Dr. Pierre says, continue to worry about the coronavirus. When we talked about the second peak, because we knew it was coming, let me let you know that the second peak is here, and especially with all of the protests that have been going across the world, I expect another peak as well, right? So again, I already saw a few people attempting to blame the protests that literally just started happening on the recent spike, and that's just factually untrue. Like, it's too soon for that. Like, it's way too soon. In a month, catch me, right? If I'll come on here next month, I'll do another one. Especially if we get to 3 million very quickly, right? I'll come in here because we will. Just be honest, guys, we will hit 3 million. Not to say we'll hit 3 million by the end of this year, but it is a possibility. But we will hit 3 million. So I want people to like get in that mental mindset that the 3 million mark is right in line with everything that's kind of going on thus far. Unless we have like some dramatic change that I don't foresee, we will hit the 3 million mark. So that being said, you guys be blessed, right? This is episode 61 of the Empower Yourself for Better Health series. As you can see, kind of scrolling below, if you want to join the Lunch Learning community, that's where you get, podcasts, you get, join my Facebook group, all the things. Text Dr. Barry, one word, 44222, get access to that. And you guys be blessed. Have a great day. Episode 71. Like I said, if you want to watch the replay will be on my Facebook page. Replay will be on, I think, wherever Periscope saves their videos, as well as the YouTube page. Again, drbarrypierre.com/YouTube if you like YouTube. Be blessed. Have a great day. Leave comment. Leave your likes. Thank you very much, Suzanne. Like, leave your likes wherever you're at. Much appreciated. Love you guys.